ways that we're reducing surgical site infections is by doing a chlorhexidine prep on all patients in labor and delivery on admission and every 24 hours after. On antepartums, we're going to do them weekly. When you do your first prep, make sure that you are scanning it into the MAR. That way it is documented in the MAR that it has been done. After it's documented in the MAR, you're going to go to the doc flow sheet and you're going to chart under hygiene. Click in the comment section. You're going to put that chlorhexidine wipes were done and that the chlorhexidine bath is checked. Prior to taking the wipes out of the package, you're going to make sure that you put your gloves on. You're going to remove the first wipe and you're going to clean the patient's lower abdomen where the incision would occur for 3 minutes. After your 3 minutes is up, you're going to take that wipe and you're going to make sure that you throw it into the red biohazard. The second wipe will be used one wipe down each leg, thigh, and over the perineum. Make sure that after the prep is complete, you allow 1 minute to air dry. Now I'm going to demonstrate how to do an abdominal prep on a C-section patient. Make sure that while you're still in the patient's room, prior to coming back to the OR, that you use the clippers to clip all visible hair in this triangular area. The reason why we're doing that is to make sure that none of the prep is on any of the hair. It can take up to 60 minutes for the prep to dry on any hair. Next, I'm going to go ahead and put chucks on both sides of the patient. And we're doing that so that any dripping that may occur from the prep absorbs on the chucks. You're going to use the Q-tips to make sure that you are cleaning the umbilicus. Next, you're going to go ahead and prep for 30 seconds the vigorous scrub back and forth at the incision site. After your 30 seconds is complete, you're going to go ahead and start moving up the abdomen and about 3 inches above the umbilicus. Next, you're going to do the thighs, moving downward. And just one swipe down the middle. And that completes our prep. Okay, so let's talk about patients who have a large abdomen or a pannus. First, you're going to want to ask the provider where they're planning to place their incision. Ask them if they want a traxi. What that does is helps hold the pannus up and out of the way. If your provider is planning to put the incision underneath the pannus, you're going to want to do a prep at the incision site for 2 minutes. So in place of 30 seconds, again, you're going to do 2 minutes at the incision site. After the 2 minutes is done, since you can't reach over the patient because of the size, you're going to end up only prepping half of their body with 1 wand. After you're done with that side, you're going to end up taking a second wand and you're going to go to the other side of the patient and you're going to prep just along the side. Remember, your incision site has already had its prep, so you won't need to do that again on this side. If the provider is going to do the incision not in the pannus and you just run out of prep on a larger abdomen, then go ahead and just use a second wand. After, you're going to pull out the chucks. Once the prep's done, you're going to make sure that you remove the chucks from each side of the patient and throw those in the garbage. You're going to allow your prep to dry for 3 minutes. The ChloraPreps, those are going to be disposed of in the new black receptacles.